Hey, Frog Prince Runner here, and thank you for dropping by. God damn it. I feel like a parrot, as I've been addressing the same issue over several videos for the last couple of weeks. But every other day, there seems to be another new article from the propaganda website DailyExpose, lying about the vaccine using the same and very transparent method. So in this video, I will speedrun through all their lies. If you want further information, there will be several links to my other videos dismantling DailyExpose lies that dives much deeper. Quick note for YouTube. As I am debunking lies and medical misinformation, I do have to show and read from the article in question. I will at the same time debunk their claims and show that vaccine actually saves lives. Now to the latest scaremongering article. Title reads, Exclusive, 80% of COVID-19 deaths in August were people who had been vaccinated according to public health data. Followed by, further evidence proving the COVID-19 vaccination program is a huge failure has been released, which confirms throughout the whole of August 80% of the people who allegedly died of COVID-19 had been vaccinated against the disease. Well, this is the fourth time I'm debunking their articles, and what they show is never any evidence, but words formulated in such a way that gullible or less math-inclined people would actually fall for, which is evident from their comment section. The article continues. We are living in strange times, and if you believe the COVID-19 vaccination program is working because the authorities on the television tell you that it is, then you must surely find it extremely strange that the UK is in the middle of a third wave in the middle of summer, especially when you consider that in summer 2020, COVID-19 deaths flatlined to zero even though a COVID-19 injection was not available. Well, without considering any other variables, as a scaremongering article would do, us rational people would actually look at those. Last year during that time, in UK, we had local lockdown in places, local authorities had additional power to enforce social distancing, and people actually followed the rules, unlike this year. At the same time, we now have a lot more variants. Alpha is the variant first discovered in Kent in September 2020. This variant was linked to a sharp increase in cases in the UK in early 2021. Then we have Beta strain, first detected in South Africa, is not believed to be more deadly than the initial strain, but is known to spread more quickly. Of course, Gamma follows Beta, first identified in travelers from Brazil. Similar to Beta, it does spread more easily than original strain. On 6th of May 2021, Public Health England flagged Delta as a variant of concern and is around 60% more likely to be spread to other people in the same household than the Alpha variant and may be linked with a higher risk of hospitalization. The Lambda variant was first discovered in Peru in December 2020. A small number of Lambda cases have been detected in the UK, and on the 23rd of June, the government designated it as variant under investigation. A new coronavirus strain has been added to the World Health Organization's watch list. The Mu strain has been listed as a variant of interest. As of 30th of August 2021, there have been 48 cases of Mu strain in the UK. Causation does not equal correlation, meaning just because two things correlate does not necessarily mean that one causes the other. This is quite evident here. More people are vaccinated does not equate to being the reason of the spike. If we look at Nigeria, a country that is yet to reach even 2% of their population as vaccinated, we also see a spike. Now, we cannot really compare these two countries, but what I'm pointing out is If vaccine is the only reason for the higher infection, then we shouldn't be seeing any spikes in this least vaccinated population. The article continues, in the most recent week from 28th of August to 3rd of September 2021, the report shows that there were 20,744 confirmed cases among the unvaccinated population, who are more likely to be tested for the simple reason they have not been vaccinated. Now, who was the smart guy saying to lower the number of positive cases, we just need to reduce the number of tests? DailyExpose follows it up with, but it also shows that there are 5,508 confirmed cases among the partly vaccinated group and 16,810 cases among the fully vaccinated population, two populations who are least likely to be tested due to being vaccinated. This means that between 28th of August and 3rd of September, there were 22,318 cases among the vaccinated population, almost 2,000 more than the unvaccinated population. It is a strategy, I will admit. Establish that unvaccinated are tested more than vaccinated group, and yet more vaccinated population are tested positive. This is completely wrong as well. My ex and her husband works at a nursing home. They both being care workers, received the vaccine a lot earlier than me, and they are still checked a couple of times a week. Now for their numbers, DailyExpose is pulling the same trick that it has been doing. That is, simply adding the numbers together instead of taking into the account of the total demography. So we have 20,744 confirmed cases out of a little bit over 1 million unvaccinated group. Even if we play their game by lumping single dose and two doses together, we have 22,318 cases among the vaccinated population, that is a little bit over 4 million. DailyExpose obviously ignores the percentage of cases as it completely breaks the narrative. Now let me phrase it this way. If vaccinated group have the same risk as unvaccinated group, we should be seeing positive cases around 83,000. We get that figure by saying if over 1 million has a confirmed case of 20,744, holding the same ratio, what would be the confirmed number of over 4 million? If vaccinated people have a higher risk, we should see a higher number than 83,000. If they have a lower risk, we should see a lower number. The actual number we have is 22,318, which is a lot lower than projected 83,000. Thus, we can say beyond a shadow of doubt that vaccinated people do not pose a higher risk. Instead of 4 million vaccinated, if we adjust that total to the same as unvaccinated group, our confirmed case becomes 5,577. So with the same total of demography, it is 15,166 cases less than the unvaccinated group and not 2,000 cases more. After using the same bad comparison couple of times, DailyExpose claims, so now that we have cleared up the experimental COVID-19 injections clearly do not prevent infection or spread of COVID-19, let's find out if they prevent hospitalizations like the authorities claim. No, the data shows completely the opposite when one understands relative percentage. Then they follow it up with, in the week beginning 21st of August, there were 15,047 confirmed cases among the unvaccinated population. Therefore, based on the unvaccinated hospitalization figures of 271, in the week beginning 28th of August, the case hospitalization rate is 1.7%. However, when we carry out the same calculation for the fully vaccinated population hospitalizations, 423, and cases, 14,519, we can see that the case hospitalization rate is 2.9%. This is new. First of all, for unvaccinated, the figure is not 15,047 but 15,647, and that case value of 14,519 is for double dose. Anyway, this is false equivalency. Up to 21st of August, unvaccinated to positive case was 1.52%, and the week after, it rose to 2.06%, where double dose to positive was 0.42%, that rose to 0.48%. Again, we see a larger jump in unvaccinated group. For hospitalizations, we see the exact same trend where for every age group, the percentage remains lower for vaccinated than unvaccinated. We see the same BS throughout the article. Let's jump to the end and death. The article reads, in the week beginning 7th of August, there were 3,788 confirmed cases among the fully vaccinated population. Therefore, based on the unvaccinated death figures of 6 in the week beginning of 19th of August, the case fatality rate is 0.15%. However, when we carry out the same calculation for the fully vaccinated population hospitalizations, 34, and cases, 3,490, we can see that the case hospitalization rate is 1%. Now, what they meant to say was that 3,788 confirmed cases are among unvaccinated. Regardless, without taking the demography into consideration, it is comparing apples to oranges. Out of the 34 deaths, 18 deaths are from the age group 80 plus. 9 deaths are from the group 70 to 79. According to the data, almost the whole population in the group 70 to 79 is vaccinated, where over 90% are vaccinated in 80 plus groups, which means we should see no additional death in 70 to 79 group for unvaccinated. Let's confirm. Up to 19th August, we had 785 deaths. Up to 26th of August, we have 785 deaths. Exactly as expected. Duh! For 80 plus, us humans being mortal, unfortunately, we expect some deaths. With over 90% vaccinated, understandably, we would have higher death count in vaccinated group. This is as stupid a comparison as my statement, Afghanistan is perfectly safe for Jewish people as no Jewish people died over there by the Taliban, while ignoring the fact that the only Jewish resident over there has left the country, meaning there are no Jewish people in Afghanistan. When DailyExpose concludes with, therefore, this shows that the COVID-19 injections are increasing the risk of death when exposed to COVID-19 by a huge 566% rather than reducing the risk by the 95% claimed by the vaccine manufacturers and authorities. It is completely wrong. One can't mix and match numbers to come to a preconceived conclusions. Math doesn't work like that. As I mentioned earlier, as most of the fallacy within this article is the same, no point of addressing each individually. But I do encourage you to look at my other DailyExpose debunking videos for further details. Well, that's all for today. If you think it's a worthwhile video, please leave a like and even share it with friends and family. If you want to be super awesome, please consider subscribing so you can be updated with my new contents. Let me know what you think in the comment section below. As always, your comments are greatly appreciated and helpful for growth of my channel. Thank you so much for watching. Wherever you are, have a safe day. Signing off.